Hello, everybody. It's Dr. Manny. I want to talk about the topic of alcohol in pregnancy. You know, everybody knows that alcohol could be very, very toxic for the unborn child, and that's why we never recommend drinking while you're pregnant. However, there are a couple of scenarios that tend to be a recurrent theme when it comes to alcohol. One is with the newlywed couple who goes on vacation and she has one episode of binge drinking while on vacation, not knowing that she's pregnant. She comes back from vacation and now she finds out that she's pregnant, comes to see me and many doctors out there and says, "Oh my God, did I hurt my baby?" Look, there's really no data to support that there's any danger to the unborn child because you had a binge drinking before you knew that you were pregnant, especially very early in pregnancy. So really don't worry about it, but do talk to your doctor because that's also very important. The other question comes with, is hard liquor better or worse than, let's say, beer or wine? Look, alcohol is alcohol, so that you really cannot make a distinction between the three. This again, when I hear that question, I always wonder whether or not the individual has a drinking problem. Look, and if you do, you got to tell your doctor because it's important to get help rather than not deal with the issue. And finally is that common question that everybody sort of asks, when they have an amniocentesis, we tell many patients to have a little glass of white wine or a nice light beer. Look, alcohol is a tocolytic. In other words, is a chemical that really helps to relax the muscles. So sometimes it's okay to have a little glass of wine.